Hi, my name is Hasty. This is IPPB, also known as Birthmark 7. IPPB was designed to help patients to take deeper breaths, stimulate a cough, and prevent or decrease atelectasis. It's effective in doing so because it improves gas exchange, increases lung compliance, and reduces work of breathing. Indications for IPPB are atelectasis not responsive to other therapies, poor cough, unable to clear airways, short-term non-invasive ventilatory support for hypercapnic patients. IPPB has been replaced by BiPAP, delivery of aerosolized drugs when SVN has failed on patients who cannot take deep breath. Prevent or decrease pulmonary edema, decreases venous return, thereby decreasing pressure in the right heart. Positive pressure may push fluid back into pulmonary capillaries, increases VT, improving oxygenation, resulting in better cardiac activity, replaced by CPAP.
Hi, my name is Danica, and I'm going to be talking about IPPB's contraindications. First one is tension pneumothorax, intracranial pressure of greater than 15 millimeters of mercury, hemodynamic instability, active hemoptysis, tracheoesophageal fistula, recent esophageal surgery, radiographic evidence of blebs, recent facial, oral, or skull surgery, singultus or hiccups, and nausea. So to show you guys how to set it up, first you have to connect the machine to the disc, the oxygen to the disc, and you insert your bacteriostatic filter to the pressure end of the IPPB, like that. And then you'll also have a disposable circuit that you will get in the bag, and you're gonna have a corrugated tubing for your mouthpiece or your mask, and then you also have a smaller tubing that goes into the medication cup for your nebulizer. You can put bronchodilators or hypertonic saline. So you would just connect the end of the smaller tubing into the exhalation port, and then the other T into the med cup, and then the other end of the circuit, the smaller tube goes into the pressure line right here under the bacteriostatic filter. And then you also connect the bigger tubing into the bacteriostatic filter. And so you would also, you can, for the exhalation port, you can either put a right spirometer, or like what we have here, we have a venti comp bag where you can calculate your tidal volume. And that's how you set up your IPPB.
Hi, I'm Aldous, and I'm going to be going over the initial settings for the IPPB. The first thing we're going to be going over is your pressure adjustment lever, which is on the right side of the machine. The initial pressure should be between 10 to 15 centimeters of water, just enough to give your patient a nice full breath. The highest pressure you can go is 35 centimeters of water. Any higher, you could cause barotrauma or volume trauma to the lungs. The next thing you can look at is your gauge, your manometer gauge, your pressure manometer gauge. Once you have your set pressure, you can check, you can verify the pressure over here. Blue side is positive, the pink side is negative. Next thing we're going to be going over is the air mix selector knob, which is this one right here. Having it pushed in will give you close to 100% FiO2. Having it pushed out will give you about 40 to 80% FiO2. So for now, we'll leave it pushed in. The next thing we'll go over is the apnea time, which is this knob right here. Decreasing apnea time will decrease the time between each breath. If you're only giving a regular IPPB treatment, you want this closed or off. So we're gonna turn this off, and The next setting we're going to go over is the sensitivity adjustment lever knob, which is on the left side of the machine. The lower the number or sensitivity, the easier it is to breathe, and the higher the number, the harder it is to breathe. And the initial setting for this is usually between -1 and -2 centimeters of water. So we'll keep it between -1 and -2. The last setting we're going to go over is the inspiratory flow rate adjustment dial, which is this right here. It's also how you turn the machine on and off. The higher the number, the higher the flow, and the lower the number, the lower the flow. These numbers do not correlate to centimeters of water or liters per minute. These are just a reference number. If you want a shorter eye time, you would make the flow higher, which will make it quicker to get to the set pressure and terminate that breath faster. If you want a longer eye time, then you would set it to a lower number, which will take longer time to get to the set pressure. Now I'm going to be going over a demo of how to use the IPPB. As an RT, your role is to make sure to set it up to the comfort of your patient. So Hasty, the way you use this is you want to keep your mouth sealed tightly around the mouthpiece. You don't want to stick your tongue inside the mouthpiece or blow back against the machine. You want to take a slow, deep, even breaths. Got it? So I'm going to go ahead and turn the IPPB on. Just take a slow, deep breath. Good. Now, if you want to measure her tidal volume, you would use a Venticomp bag. And the way you would use that is you just insert the Venticomp bag into the exhalation port or valve, just like so. And go ahead, Hasty, take a nice, slow, deep breath. And you would count how many breaths it takes for her to inflate the bag. So that's 1, 2, 3, keep going, 4. So that's good. Once it's fully inflated, you can take the bag off. It took her 4 breaths, so her tidal volume is 1200, which is what we're looking for. The way you calculate tidal volume is it's 12 to 15 centimeters or milliliters per ideal body weight in kilograms. So yeah, that's what we're looking for. So that's how you use IPPB. Thank you.